All right. Well, good afternoon, everybody, and thank you for joining us today. We are having a wonderful webinar. Bring your lunch and get comfortable, and we are here to provide you information about comprehensive eye care on campus. So as you prepare your student to return to campus or join us as a new Blazer, we wanted to let you know and receive some information about what services are available to take care of your students' eyes. And so we have a wonderful presenter with us today. We have Dr. Janelle Sventek from the UAB Eye Care Center, and she will let us, take us through a little journey about all the services that are offered, how your students can take care of their eyes, and just things for you to know and think about before your student joins us on campus. So, again, the way that we will proceed today is we will have our webinar, and at the very end, you're welcome to submit questions, or as you're hearing the presentation, if you have any questions, just put them in the Q&A section. We are also live streaming live on Facebook, so you can also add your questions through the comment section. So if you see me turning my head, it's not because I'm not paying attention, it's because I'm checking Facebook to see if there's any questions. Again, join us, bring your lunch, and enjoy your lunch while you listen to the webinar. And then at 2 o'clock, you're also invited to come back and join us for the next webinar of today, which is Fraternity and Sorority Live. And tomorrow, you're also welcome to join us for the biggest and most awaited webinar, which is Living on Campus by Student Housing and Residential Life. That'll be tomorrow at 12. And again, if for any reason you can't join us for any of the webinars, or if you've missed any of the previous webinars, you can always watch them on Facebook. They're recorded and they're there for your viewing and for you to share and review as your convenience. And we've also uploaded all of our webinars, previous webinars, to our website, uab.edu/families, under communications, under 2025 webinars. So feel free to go back and view them. If you have any questions, of course, you can always email us as families@uab.edu. So after having taken care of some household business, I would definitely love to introduce you to Dr. Janelle Sventek, who will do our presentation today. So thank you, Dr. Sventek, for being here with us today, and it's all yours.
Thank you. Thank you so much for having us. So I'm Dr. Janelle Sventek. I am on faculty here at UAB School of Optometry, but more importantly, I see patients in our UAB Eye Care company and our business. So let's dive in. This is obviously a little bit about me. I am full-time staff here, and so UAB Eye Care is the clinical operation for the School of Optometry. So we have optometry students that are seeing patients that are overseen by attendings like myself. We are located next to Callahan Eye Hospital, but across from the School of Nursing, right on University Boulevard. We have about a 34,000 square foot area that we're working out of for our clinic. We provide comprehensive eye care in a modern facility that is constantly being updated and renovated. And we have amazing equipment that we get to use on our patients, the highest and newest technology as well. So we would like to be your trusted eye care away from home, and that's what we hope to be for you. And so let's go ahead and dive on into some of our specialty clinics. So our specialty clinics, we have a lot of them. Our main one that we're going to chat about a little bit is our optical services. We're just like any other optical that you have at home where you can get glasses and contacts. We also provide community eye care in the area. We have a cornea and contact lens service. So if you wear contact lenses, that's where you would be seen and evaluated to get that prescription renewed for yourself. We also have some specialty clinics like our dry eye relief clinic. We also have a sports-related concussion clinic, a myopia control clinic, ocular disease clinic, and then a few others. Our pediatric clinic, we usually are seeing patients from 18 years of age and younger. So a majority of you would fall into the bracket of just seeing in our regular primary eye care clinic. And then we also have a vision therapy clinic, which we'll talk a little bit about in a bit. So let's chat about our optical services. We offer the ability to make eyeglasses and sunglasses from prescriptions that we provide for you, or maybe you have a prescription from home. If you lose or break your glasses and need them replaced, we can certainly do that for you with a valid, non-expired prescription. All of our opticians are American board certified, which is important because you want to make sure that the glasses are being made and appropriately measured for yourself. We have different brands of eyeglass wear. We've got Versace, Kate Spade, Coach, and some of the popular ones that you're probably familiar with. We are also out in the community, so you may notice UAB Eye Care signs around your neighborhood and where you're traveling to and from. We're not only in Birmingham, but we're also in rural Alabama. We extend all the way into the Black Belt for providing care into the community. And we have a program where we do, it's called the Gift of Sight every Christmas, where we provide eye exams and eyewear for individuals out in the community. These are some of our locations where you can find UAB Eye Care. If you wanted to come in as a student for an eye exam, you would just come into our main campus, UAB Eye Care location. Like I mentioned, that's off of University. We also have a program where we partner with UAB Athletics. It's called Blazer Vision. This is where we provide vision screenings as well as full eye exams for the athletes. We are also on call for acute game time care. So if somebody accidentally gets scratches on the eye or something happens, we're there for them. And then we also have a way of doing baseline testing for concussion protocol. And so a lot of times after a head injury or a concussion, whether sport related or not, we can start to have vision difficulties after that. And so we partner with UAB Athletics to monitor that. If you or somebody you know who, even if you're not an athlete with UAB, if you suffer a concussion, we also can provide really important care for you in our post-concussion clinic, what we call our MTBI clinic. We also do lots of clinical research here at UAB Eye Care. We are doing research actively in what's called myopia control, and this is a way of slowing down the prescription of the eye. We also are doing clinical research in dry eye disease, eye turns, and amblyopia. Amblyopia is when you have one eye that doesn't see as clearly as another. Usually it develops in a young age as a child. We also are doing research in our concussion clinic as well. So feel free to screenshot this or take a picture if you're interested in going into one of these research programs and being a participant in them. Usually you get compensation for completion of each study that you do. And so if that's something you're interested in, there's certain criteria, but you're more than welcome to reach out. These are the emails of the individuals who are in charge of those. So obviously, eye health is linked to our overall health, and it's really important to have a holistic approach to your well-being. We can look inside the eyes and we can find systemic diseases. We can find importance of treating those diseases and making sure that they're well managed and maintained. And the best way to do that is through a regular eye exam. So when should you schedule an appointment? Great question. Well, if you need a routine eye exam, maybe you don't wear glasses or contacts, but it's been a while since your last eye exam. That would be our routine eye exam. We highly recommend those at least every 2 years, if not every year, depending on your age and your family history. If you need to update your glasses or contacts, obviously that's what we're here for. If you're starting to notice that your vision is blurry, maybe you have eye strain, pain, redness, or maybe you think you have an eye infection, we are here for all of those needs as you're home away from home. These are the top 3 reasons why we recommend you should come in for an eye exam. The first one being if you have blurry vision or what we call uncorrected refractive error. Second reason being if you're having double vision or if you're having accommodation and convergence issues. And then the last reason you should come in is just because you're having clear vision and you think your vision is good doesn't necessarily mean that your eyes are healthy. So we're going to dive into each of these a little bit. So first reason being uncorrected refractive error. 70% of the US needs prescription glasses. Usually, if we need glasses but don't have them, we will experience things like blurry vision, headaches, eye strain, and difficulty with our 3D vision. About 45% of America is myopic, and that means that the eye is too strong or too long. And so the image is actually focusing in front of the retina. And so they require glasses to make that image clear on the back of the retina. You can see that in the little graphic that we've got here. Now, less common, we've got 11% of the US is is hyperopic, and this is the opposite of myopia. And so hyperopia is when you're farsighted, so you can see far away but need a little bit of help up close, and that means that the eye is too short. And so images are focusing on the back of the eye, and so glasses will move that image onto the eye to make it clear. And then 40% of America has astigmatism. You may have heard this word before. Astigmatism means that the eye is more curved and it creates multiple focus points. So you can see that on the photo at the top here. And then once we give it glasses and we correct that vision, it provides a single focal point for you to be able to see nice and clear. Second reason why you should come and see us is if you're having double vision or difficulty with using your eyes, and those can be accommodative or convergence disorders. 80% of our learning is achieved through our eyes. 17 visual skills are required to read, write, and learn. And our vision actually projects to 30 different points on our brain. And so our eyes and our brain are super important when it comes to learning. Some symptoms that you might experience if you're having accommodation or convergence issues is if you're having headaches, eye strain, double vision, loss of place when you're reading, or you're having a hard time remembering what you read or having difficulty comprehending what's being read. Convergence and accommodation disorders can become worsened by increased stress as well as extended near work. And so if you've got a big project and maybe you're spending a lot of time on your laptop and really not blinking your eyes as much and giving your eyes as much of a break, that can certainly cause these disorders to get worse for you. Learning related vision problems that we most commonly see is going to be difficulty with eye tracking, eye teaming, and eye focusing. So we're going to talk about those a little bit. Difficulty with eye tracking is kind of like losing your place while reading. So this is a little bit of a video graphic to kind of give you an idea of what it might be like for somebody who has difficulty with eye tracking and is having a hard time reading. When your eyes are working so hard to figure out where they are, you won't remember what you read. And so this can also cause difficulty in the comprehension or the remembering of what you read. Secondly is failed eye teaming or difficulty with fusing our eyes or converging them together. And when our eyes don't team together, it can kind of make the words split apart or maybe look double or kind of smeared or smudgy. So this is a common condition after concussions. A lot of individuals after concussions will have convergence insufficiency. It's the most common cause of difficulty with eye teaming. And then the last one is called difficulty with eye focusing or your accommodation system. And so you'll notice on this graphic here that all of a sudden the words are kind of going out of focus. And this can happen if individuals maybe don't take enough breaks when they're doing screen time or near work, and their eyes will kind of go out of focus. The good news is that all three of these things are easily treatable. The treatment options either include maybe a baby bifocal that will help the eyes feel a little bit more comfortable when looking in down gaze to read. And then another option is vision therapy, which is a service that we do offer here at UAB Eye Care. Vision therapy is kind of like physical therapy, but for the eyes. Well, we provide you with specific skills and exercises that you can do at home to help strengthen your eyes. And you usually go through a course of therapy exercises for about 10 to 12 weeks. So the third reason why you should come in for an eye exam is because just because your eyes are good and you feel like you're seeing well doesn't necessarily mean that they're healthy, right? And so this is an example. We have examined a 29-year-old female, and it might be hard for you to tell, but this is the back of the eye. This is the retina. And we've got kind of this border of darkness that's happening underneath the eye. And this has actually turned out to be a melanoma. And so this individual saw perfectly clear, did not need glasses or did not need contacts, but during our full eye exam, we were able to discover that they did have this lesion and melanoma. It ended up being in the back of their eye. And so here's some other examples in regular eye exams with eye dilation. And these photos are called optos photos, which are wide field images of the back of the eye. And so you can see we've got some retinal holes and tears and just changes that should not be happening in the back of the eye. And all of these patients and all of these photos, these were young, healthy individuals. And so we were able to provide them with the care that they needed to preserve their vision. If you have a retinal hole or a tear that continues to progress, you can develop what's called a retinal detachment and you will have loss of your vision. And so it's important to catch these things sooner than later. And these are all things that we screen for regularly during a regular full eye exam. This is an example of a 21-year-old who was having symptoms. She was having headaches and she came in and When we dilated her eyes, we looked into the back of the eye, and you'll see here, this is the back of the eye. This area here that I'm kind of pointing to, that's called the optic nerve, and that's what connects the eye to the brain. And if the optic nerve starts to experience some swelling, it will kind of start to look like this. So basically, these photos are not healthy. And so we ended up sending this patient over to the emergency room to have some imaging done, an MRI, and they actually found that she needed additional treatment to lower the pressure in her spine and in her brain to help improve the function of the optic nerve. So this is a worst case scenario, right? Not everybody gets this, and it's pretty rare, but it certainly can happen. So if you're starting to have changes or symptoms or things that you can't really explain, certainly please come in if you think it might be from your eyes. What is eye dilation? That's a great question. Well, we use this drop called tropicamide. It's a fancy word that just means we dilate your pupil. Why do we dilate a pupil? We want to do this because we're able to examine more of the retina in the back of the eye through a dilated pupil than an undilated pupil. What happens in an undilated eye is if we shine light inside, your pupil, or the black part of your eye, kind of shrinks down, and then we can't get as good of a look inside. But when we dilate the eye, when we shine that light in, your pupil doesn't react, which is what we want it to do. And so when it doesn't react, it allows us to examine more of your retina to make sure it's all healthy. Eye dilation can tend to make your eyes a little bit more uncomfortable. You can be a little bit more light sensitive. And so we give these little roll-on sunglasses to send you home with. Sometimes people will ask, can I drive after I've had my eyes dilated? You certainly can if you feel comfortable and can see well enough. If you don't feel comfortable driving while dilated, then it is recommended that you have somebody bring you for your eye exam. But this is why it's so important to have your eyes dilated at every eye exam. Our recommendation of when you should have an eye exam, depending on the patient's age and if they're at risk or not. So everybody that's starting maybe at UAB falls into that 18 to 39 bracket. And so at least every 2 years, it is recommended for those that are at risk to have it annually. At-risk patients would be those that have a family history of glasses, if you yourself wear glasses or contacts, or maybe if you have a family history of other eye conditions that you know of, that would put you into the bracket of coming in every single year. Now, insurance can be sometimes confusing for eyes, and so it's important to know the difference between medical insurance and vision insurance. And so a routine eye exam is one that can be billed to our vision insurance. That is when we're checking for, glasses and contacts and updating things like that. Now, if at any point in time during the exam we do discover or uncover a medical diagnosis or we're evaluating for an eye infection or dry eyes, or maybe you have had a loss of vision suddenly, and it's a little bit beyond just glasses and contacts, then that's where medical insurance would come into play. And so these are some of the insurances that we accept on the left side here. And so we can bill your medical, through Blue Cross Blue Shield if you're having a medical exam. We can also bill your VSP, your vision insurance, if you're just having a glasses and contacts exam. Now, if you're planning on not using insurance, we do have some discounts. So we offer what's called a green and gold eye exam, and this only covers glasses alone. So you have your full eye exam for $89 here at UAB Eye Care. We also offer 25% off eyewear if you're not using insurance or don't have insurance. You can also get a discount when you purchase a year's supply of contacts. You will get 50% off a complete pair of glasses, and those can be sunglasses as well. We also have, if you buy one pair of glasses, you can get 50% off your second complete pair, whether that's glasses or sunglasses. And then we also offer for students 50% off of out-of-pocket services like our vision therapy or myopia control. So if you end up noticing that you're having difficulty with eye tracking or teaming or focusing, and you end up needing vision therapy, you may qualify for that discount as a student. It is easy for you to book for an exam online. If you visit our website, the first homepage, this is kind of what it looks like, and you'll be able to click that button where you can schedule an appointment. I'll leave these little QR codes up. The top QR code is to schedule an appointment and bring you to our website. And the bottom QR code is to follow us on Instagram. We are actively posting on there. We will post updates about our services that we're providing, as well as any promotions or any discounts that are currently being offered as well too. So with that being said, I'll pause here. This brings me to kind of the conclusion of our presentation. I'm happy to answer answer any questions, feel free to plop any into the chat box there. And if you think of any questions later, you're more than welcome to always reach out. Our phone number is there as well if you need to schedule an appointment. We are happy to be your eye care home away from home.
Thank you, Dr. Sventek. This has been very useful because I know family members often think about all the details and everything that they will need to remember when they're transitioning their students. Students may not, but family members I know do. So this is good to know all the services that Eye Care offers on campus for UAB students. And so it's funny that you mentioned, I was talking to a couple of students, I think it was yesterday, and the big question they had was, they asked me if I slept with my glasses on. I was like, with my glasses? And they said, yeah, do you ever fall asleep with your glasses? I said, no, last time I did, I broke them. So in the eventuality that that happens, because the student said, oh no, I sleep with mine I go to sleep, I fall asleep with them all the time. I'm thinking, they might break. So if they have one of those emergencies, could they come over, and how long would it take for the new glasses to be made? Or would you recommend that they have two pairs just in case something happens?
That's a great question. I always recommend having a backup pair of glasses, especially if your prescription is really high or really strong, or you require your glasses all the time. You should always have a backup pair in case of those accidents. If you do break your glasses while, away from home and on campus, we certainly can get you a new pair ordered, right? And so depending on which frame style you pick out and which lenses you want, usually takes about a week or two for them to come in as well. But we do offer as well free screenings. And so if you've never had an eye exam before, or you're not sure if you need an eye exam, please stop in. We offer free screenings and you don't need an appointment. You just can walk right into UAB Eye Care and we can always screen for that for you as well too. But if the glasses break, we can always get you a new pair ordered, assuming you have an updated prescription or a prescription that's still not expired. If it is expired, then of course we'll do a full eye exam for you.
A question that also came up in a previous session and conversation with families is oftentimes students will call home and say, my head hurts, or I have to rub my eyes all the time, or something doesn't feel right. Would they need to go to the student health center first, or to eye care first? What would you recommend?
It depends. If your symptoms are mainly just related to your eyes, right? So let's say it's springtime and trees are blooming and your eyes are feeling itchy and bothering you and irritated, definitely come to UAB Eye Care. If you're noticing that your eyes are feeling dry or tired at the end of the day, or maybe you're noticing that the headaches are happening only when you're on the computer or doing screen time, that's probably an eye-related thing. If you're noticing that you're getting headaches and it's like all the time, all day, every day, that may be something where you want to go to the student health clinic, be evaluated there first. And if they don't necessarily get you any answers or have any reasons as to why you're having those headaches, we're certainly welcome to come here for a full eye exam, especially if you haven't had one in the past 12 months. That's definitely recommended before you start chasing your tail trying to figure out why you have a headache. Most commonly, it is actually just your eyes.
Great, thank you. And one other question that came up was also about the current prescription. So if a student had a prescription, let's say 6 months ago, should they go ahead and have one and bring it with them, or just bring that 6-month prescription with them and then update it in the next 6 months?
Great question. So if they had a prescription updated about 6 months ago, I recommend bringing a copy of that with them to school, and or just having a digital version of it right on your phone or something like that is helpful. And then you would be due for an eye exam 6 months from then, right? So if you had an eye exam, let's say in January of 25, and now you're, moving on to campus, your prescription's still valid and good to go, but you will be due for a full eye exam come January again. So whether you do that at home or here at UAB Eye Care, we're certainly here for you. If your glasses do break, or if you run out of contact lenses and you need your contact lenses, you need to renew them and order more, making sure you have a valid copy of that prescription will make the ease of ordering a little bit better for you too.
All right, awesome. So families, I thank you for joining us on Zoom and on Facebook, and that's why I'm turning my head, waiting to see if there's any questions on Facebook. Again, if you have any questions, you can put them in the Q&A section before we end in a couple of minutes. If you have additional questions that come up later, or you think of anything else, please let us know. The phone number for the Eye Care Center, UAB Eye Care, is on the screen. It's 205-975-2020. And if not, you can send us an email at families@uab.edu, and we will be glad to filter and send those questions to Eye Care so they can get back to you or provide you with timely answers. So I am not seeing any questions as of now. So do you have any last minute, maybe one or two tips for families as they prepare everything that they're going to bring when they move their student into campus in a couple of weeks?
Certainly, if you wear contact lenses, make sure you're coming to school with those contacts and having, your solutions that you use to clean them and things like that. If you've got backup pair of glasses, maybe bring both with you in case something happens to one. At least you've got a backup to hold you over. And even if that's an older pair, I think that that's still a benefit to have that with you as well. But just know that we're here for you and we offer great discounts for the students. So if they need us, please just remember UAB Eye Care. It's just on University. We're super close by to all the campus activities, and so if you need us, we're here for you. And then if you start school and you're wondering, do I need an eye exam or do I need glasses? Stop in for one of our vision screenings. It's completely free. You just pop on in. No appointment needed. Just tell them you're here for a screening, and then we can let you know, if you need to have a full eye exam from that point or not.
Awesome. And one thing I wanted to mention, I know that at some point during the academic year, there's also special activities that are held at the Eye Care Center. Is there like, I think there's something about glasses and frames. Am I thinking correctly or?
We do have different promotions and things that go on. The best way to keep track of what's going on is going to be to follow us on Instagram. That's where we usually post a lot of our updates about, if we're having any special activities and things like that too.
There you go. Another reason to be on Instagram is to follow Eye Care. So
Yeah.
we thank you, Dr. Sventek, for being with us today. And Satina is there somewhere as well. So we thank you all for being with us today. And thank you, families, for joining us here on Zoom and on Facebook. Again, if you have any questions at any point, send them over to families@uab.edu, and we will make sure to get you to the right people to get your questions answered. Again, join us at 2 p.m. if you're able for the fraternity and sorority webinar today, and tomorrow at noon for the Living on Campus webinar. So we thank you all very much, and thank you, Dr. Sventek, again for being with us today. And enjoy the rest of your lunch break, everybody. We'll see you later or tomorrow. Have a great one.
Thank you.